Good afternoon. I'm George Latimer, Westchester County Executive, and this is our 2 o'clock update for Tuesday, May 12th, regarding the spread of the coronavirus in Westchester County. For those who may be watching from the press, we know that the governor is still making his remarks. However, since we're accustomed to doing this at 2 o'clock, we wanted to make sure we did it at 2 o'clock. Our update is going to be relatively brief. We also know that our Congresswoman Nita Lowey is making an announcement today about additional funding at this hour as well. So there's news being made in a number of different forms. We basically wanted to talk statistically today, very briefly. We have not gotten an update from the New York State Department of Health tracker report from which we draw information about the number of positives, the number of fatalities, and so forth. And this is a good opportunity for me to say that the numbers that we report from Westchester County are all driven around testing and reporting from the hospitals and from the various testing sites that go directly to the New York State Department of Health. They provide information for the county to download. We subdivide it into the local municipality numbers because obviously people who represent the towns, the cities, and the villages of Westchester County want to know where they stand individually, not just in the aggregate countywide. So our situation right now is limited by the fact that there are no new numbers for today. The numbers that we had yesterday, which we reported yesterday, part of the public domain yesterday, are still the numbers we're working off of today. We do have updated numbers for the antibody testing, which is going on as we speak at the Westchester County Center. This is the second week that we've had testing there. And now this is the seventh official day of testing. The antibody testing is being done by Westchester Medical Center. They're not only taking the tests at the county center, but they're also processing it in their labs. And over the course of the last few days, they've reached 2,000 tests, and each day a little bit larger amount. Yesterday, 464 tests. The Friday previously, 407. And beginning with last Monday now, totaling over 2,000 tests. It is targeted to first responders in Westchester County government and as well those that work for the other local governments, the cities, the towns, the villages across Westchester County. When those numbers are reached, we are looking at trying to identify other workers who will be considered essential, but not necessarily first responders, who will also want to make sure we test, and that will happen both at the local level and at the county level to try to get a database of those individuals. The antibody testing, and of course I'm not a medical scientist, tells us who has within their system antibodies necessary to fight the COVID virus. It normally means that you have had COVID and it did not affect you. Your antibodies were created and fought off the disease, and now you have those antibodies yourself. The immediate practical benefit of it is for those who choose to donate blood, that the blood plasma that comes from your donation has those antibodies in it, and that is helpful in dealing with those patients that are being treated, suffering from severe cases of COVID-19, when they're in a hospital situation and setting. It also provides some information for the individual, particularly if they're a first responder, about what we believe is their relative immunity. We don't know that it is a sure complete immunity, but a relative immunity from the disease, and allows them to continue to work in their first responder responsibilities. And whether you're a local firefighter, local police, EMS worker, or at the county level, a corrections officer, county police, those who work in the emergency services department at the county level, your service is essential. And healthcare workers, your service is essential. And we want to be able to know that those workers can do their jobs and provide that benefit to the greatest extent possible throughout this contagion. But the antibody testing continues. It is also now underway today at Northern Westchester Hospital. They have established 2 testing sites, one in Mount Kisco where the hospital is located, and then one at their facility down the Sawmill River Parkway in Chappaqua, the Chappaqua Crossing Complex, and where there's a presence for Northern Westchester Hospital. So those are 2 sites that are up, and they're also helping with those individuals that are working in Northern Westchester as first responders. And of course, there's many people who fight fires and who provide emergency services response. So there's any number of different people that will get through this process. We expect to test quite a large number before this is over. And then there'll be some discussion about whether or not these tests can be made open to a more broad-based group of residents, and we will try to do that. On the COVID testing side of the equation, we now have many testing centers all across the county. Governor reported that Grace Baptist Church in Mount Vernon was going to become part of that testing module as well, along with many of the other sites we've long since talked about at Glen Island, Westchester Medical Center, and so forth. As of yesterday, we don't have a current day number, but 112,663 Westchester residents were tested for COVID. Over 70% of them came negative, and under that, under 30% tested positive. So all of the numbers of positive cases we have, as large as an absolute number as that might be, that represents slightly under 29% of all the people that were tested, and then slightly over that number in the 72% range. I think it's about 72 to 28 as a ratio. Those who are tested negative were tested and seen as not having the COVID virus. Obviously, a negative test is not a permanent reality. You could, in theory, be exposed to COVID virus after you'd had that test. But generally speaking, we think it's a good trend to see that it's better than 2 to 1, better than 70-30, that those who are tested do not have the virus. That is, I think, helpful news. What's important about the absolute number of 112,663 tested as of yesterday, that number will rise when we have today's numbers. So that represents 11% of Westchester County, every man, woman, and child. 11% of our residential population has been tested. And as I transition into what my main discussion is today, which are these criteria to reopen the economy of Westchester County, testing, total number of testing is a very important number, and Westchester has led in that regard. Now, yesterday I mentioned, and I'm going to repeat them again, that the governor has laid out specific 7 basic categories that have to be satisfied on a regional basis in order for the reopening of the economy, all of the different businesses and other types of activities that have been shut down. Those shutdowns have been made by gubernatorial executive order, so therefore it is within his power to lift by executive order those sanctions in whatever businesses and under whatever parameters he chooses to do that. No mayor of a city, no supervisor, mayor of a village, county executives do not have superior authority. The governor has laid out this game plan. It will be done on a statewide basis. He is certainly trying to coordinate with neighboring states, but different states have different priorities, and so you will see some differences when Connecticut opens, when New Jersey opens. But we're following the authority that's given in New York State to the governor, Governor Cuomo, on these issues. He laid out 7 thresholds, and I want to just highlight each of them. Then I want to talk about what those numbers mean in real-world terms. The first threshold is that must be at least 30% of all hospital beds in the county must be open and available for COVID patients should the surge occur and should we need to have those hospital beds. And that there will also be 30% of the available ICU beds at any point in time. In practical terms, the number of hospital beds in Westchester County is about 3,100 beds. The number of ICU beds originally is targeted at 160 beds. Now, we've taken the Westchester County Center, converted it into 110 hospital beds, and we believe they represent potentially ICU beds, that the right equipment can be put in and they can be transitioned and open for that purpose. So with that thought in mind, if you have 3,100 hospital beds, you need to have at least 900 some odd beds, 935 to be specific. There have to be that many beds available according to this threshold to reach that one threshold. And the second threshold, the number of ICU beds, is 160 ICU beds in Westchester County. 30% of that would be 48 beds. If you add 110 ICU beds at the county center in both of those 2 categories, you easily satisfy the 30% ratio in both of those 2 categories that are 2 of the 7 necessary toward our goal. In terms of the number of people that are hospitalized right now, the most recent figure we have dates back to yesterday, 503 patients hospitalized for COVID. So if the total base of hospital beds is 3,100 hospital beds, and there's only 500 that are hospitalized right now for COVID, that means regardless of other uses, pregnancies, deliveries of babies, people that are in for other important operations, stroke victims, heart attack victims, and so forth, but only 500 of those 3,100 beds are set aside, 500 are used for COVID, we clearly meet the 30% availability threshold. And if the ICU beds, 160 plus 110 at the county center, totaling 270, are necessary, then we need to have something to the tune of 60 some odd beds, available ICU beds, a little more than that, and that would be available given the base of what we have. So in those 2 criteria that's been set down for reopening, Westchester County can satisfy. Now, I should mention that we're not satisfying it by county, although the only thing we can impact is Westchester County. Westchester County is part of the Hudson Valley region, Mid-Hudson region as it's called, and there's a 7-county presence. It's Westchester, Putnam, Rockland, Orange, Dutchess, Ulster, and Sullivan counties. And just to give you perspective, that's a population base of 2.3 million people. And of those 2.3 million people, Westchester County represents 900 some odd thousand of them. We've seen numbers of Westchester population that's 968,000, 974,000. They're all estimates until the new census comes in. I believe the new census will show that we've hit 1 million people. But in practical terms, Westchester County is 42% of the population of the Hudson Valley region that we're discussing here. So if we hit the mark as far and away the largest piece of the county, no other single county is even half our population. In fact, the two next largest counties together do not equal our population. What happens in Westchester will have a very important force in the opening of the Hudson Valley region. And when we have as many available beds in Westchester alone, that can satisfy the overall Hudson Valley requirement. Now, for those of you who might be watching this outside of Westchester County, there's been some discussion by some of the smaller counties in the northern part of this region that says, well, maybe Westchester and Rockland shouldn't be included in the region because we feel that they've had more cases of COVID, they're bigger counties, certainly Westchester is, and that might pull down the numbers for the region. But the point of fact is when we have as many available beds as we have in Westchester, we're actually providing a benefit to the rest of the region. Rockland County has 2 hospitals, and there's a small number of hospitals in most of the rest of those counties. Westchester has 10, 11 hospitals, a major tertiary care facility at the Westchester Medical Center. There is no other tertiary care facility in the other 6 counties that comprise the region. So we're actually providing a benefit. And as we look at checking off the list, hospital beds and ICU beds are 2 of those issues. The next one I want to talk about is total testing. The expectation is that the county, in general, the region, will have at least 30 tests for every 100,000 people. And by that standard, we should have 30,000 tests a month for COVID testing. Now, in Westchester County alone, as 42% of the region, we had through the end of April a grand total of testing that was 92,829. So if the goal in a county the size of Westchester alone was 30,000 for a month, we tripled that over the course of the first 2 months. All of March and all of April, we ended up with 92,000. As I just mentioned, as of today, we're at 112,000. So we are overperforming in terms of the number of tests for the region and performing more than 42% of the testing, and we will help the region qualify under the total amount of testing because we have tested as aggressively as we have in Westchester County. So once again, another reason where Westchester is overperforming and thereby helping our brother and sister counties in the Hudson Valley achieve the third set, which is the issue of overall testing. The next 3 categories relate to declines in ratios, decline in hospitalizations, a decline in overnight hospital-based deaths, and a decline in the number of new hospitalizations. Now, when the governor's standard includes deaths within a hospital setting, they're taking out of the mix the various nursing homes. And the nursing homes are clearly a concentration of population that is most vulnerable and has had a concentration of those fatalities and illnesses. However, people who are in nursing homes are not generally out in the population at large on an ongoing basis. So while they live in the county in a facility, they're not out in the normal flow, and therefore, if they're picking up the disease, they're not picking it up through the normal flow of the society. You're shutting the society down. You're closing restaurants and bars and special events to avoid the spread. But nursing home patients are not out in the community as part of the spread. So their impacts are taken out of the mix. And what we're looking at is what is the hospitalization rates, what is the death rates and the new hospitalization rates in the general population. When we look at Westchester numbers alone, we're seeing a dramatic decrease, first of all, in hospitalizations. If you go back a month, I shared these figures the other day, we had 1,194 people hospitalized roughly a month ago. And today, the most recent number we have is 503. That's more than a 50% drop in hospitalizations. And if you look at the number at how that has gone day after day, when we were at the peak of 1,194 cases, and you start to follow day after day after day, those numbers continue to drop down to 1168, to 1125, to 1089, 1074, down to 990, 953, 892, 877, 868, all the way down in a steady decrease to where we are as of yesterday at 503. That reflects the next category that the governor has laid out, at least 14 days in decrease in hospitalizations. And that number in Westchester, which is 42% of the region, has been a steady decrease. So it doesn't really matter where you began the analysis from. Wherever you begin the analysis, I go back a month ago, which we believe was our peak, we have shown a decrease in the number of people that have been hospitalized. We have had an accumulation in the number of people that died because the absolute number can only grow. There can never be the reversal of the death. However, the number of people that pass away each night, the overnight fatality rate, has to decrease for the last 14 days. And that's done on a 3-day rolling average, which means today's number for Tuesday would be a combination of what happened on Monday night, on Sunday night, and on Saturday night. If you want the number for Monday, you would check back and see what happened on Sunday night, Saturday night, and Friday night. That's a 3-day or 3-night rolling average, and that adjusts each day with what's happening. And if you just look at the last week and where we've gone in the number of fatalities, to give you an idea of what we've done, last Thursday we had 17 deaths. We had on Friday night 7 deaths, 12 deaths on Saturday, 15 on Sunday, 9 deaths on Monday. Now, when you take the 3-day rolling average, while you've had some little spikes up and little spikes down, when you average it out, you'll see that there is a decrease over those days. It does not hold over 14 days because we had a particular day where we had a spike high number. But looking at the total list, if you go back, again, over the last month period of time, you go back to the early part of April, and we saw nights that were 46 deaths. The next night, 39 deaths. The next night, 44 deaths. Those are huge amounts of deaths in individual nights. The last 3, 4, 5 nights, 7 deaths, 12 deaths, 15 deaths, 9 deaths. Every death is a tragedy. We created the Ribbons of Remembrance program at Lenoir Preserve to make us remember that these are human beings, they're not statistics. But in order to open up the society, the governor is looking us to show a decrease in the number of statistics, less overnight deaths, night after night, over a 3-day rolling period of time over the last 14 days. We have not reached a 14-day period yet, but we can state that it has consistently gone down over 14 days. This is one of the areas that the state is waiting to see how we can adjust those numbers and what can be done to make those numbers smaller so there's a greater sense of comfort. The next standard is a decline in the number of new hospitalizations, and they've said limited it to 2 new hospitalizations per 100,000 people. Why? That shows that the spread is not moving fast. There's a very limited number of new people hospitalized. You have a certain number of people in the hospital, and that number is declining, but you don't want to see that replaced by more people coming into the hospital on a higher ratio that brings the numbers back up. And so you're looking at 2 different factors that work in some degree of harmony. The metric here is 2 per 100,000. So for the sake of Westchester County, 2 per 100,000 means no more than 20 new hospitalizations each day. Not new positive tests, but new people that are hospitalized. And that number, we do not have access to that data. Who comes in new in the hospitalization? We get a net number every day. That net number has gone down, as I described a second ago. But how many of those individual patients were there already? How many got discharged? And how many new people came in? And even if the discharge and number of new people coming in represented a decrease in the total number of people hospitalized, the governor's standard is that there not be more than 20 new people coming in every day. Even if the net is decreasing, they would want to know that the individual intake is also less each day. And at 20 per night in Westchester County, that may be a tough standard for us to reach. That would have to show that the infection rate is slowing down dramatically with new infections. Again, all of these standards aren't met just by Westchester County alone, but we track the Westchester number. Putnam tracks Putnam, Rockland tracks Rockland, and we work together as we go forward. The final one of the 7 standards to reopen the society is establishing contact tracing. And contact tracing is a very difficult process. What it basically says is that every person who tests positive for COVID now must be identified as who they were in contact with over the last period of time of infection or potential infection, and then trace how many of those people we also got infected, how many people they then infected other people. Because the way infection works is a multiplier effect. I infect 5 people, all 5 of those people affect another 5 people, and the multiplication goes out and the virus spreads. And he wants contact tracing with people on the telephone talking to individuals and to find out who also may have gotten that disease. Now, it may be that the individual can identify their immediate family, spouse and children, can identify the people that they work with. But they may also have to identify when they stop by a delicatessen or grocery store to pick up something. Did they have close contact with workers at the luncheonette or the grocery store when they were shopping? Or if they had interaction with a person at a gas station, or they were with some friends of theirs taking a walk in one of the parks where you're allowed to do it. And then the contact tracing structure, we need approximately 30 people for each 100,000 population to do all of this legwork. This is detective work at a tremendous level of volume that has to be done. What the governor wants is to have contact tracing in place in order to satisfy the goal. So not necessarily what is the output of contact tracing, but that there be at least X number of people in place. And in order to do that, the Westchester portion of that goal would be 300 people in place. The Bloomberg Initiative will be paying for 50 of those individuals, and they will be hiring individuals, but the county will have to be responsible for paying, unless they're volunteers, 250 people, and that is a cost borne by the county that was not anticipated. We believe that would be reimbursed in the future by state funding or other funding, but for our purposes, we don't know what's going to reimburse it, but we have to spend the money if we want to do it. So when somebody says to me, and I get this question all the time, every day, on the telephone, when I call into a Zoom meeting, as I interact with people, when are you going to open up Westchester? Westchester and the rest of New York State is going to open up at the governor's direction on the assumption that regions, not individual counties, meet all of these 7 criteria: number of hospital beds, number of ICU beds, total amount of COVID testing, a decline in hospitalization, a decline in overnight hospital deaths, a decline and reduction in the number of new hospitalizations not to exceed 2 per 100,000, and the establishment of contact tracing. Those are the 7 metrics. When you've read that the Finger Lakes, the Mohawk Valley, and the Southern Tier can satisfy this, those are regions created by the state or identified by the state. The Finger Lakes focus around, as you might imagine, the area in Western New York, the Southern Tier directly below that, along the Route 17 corridor. You'd have to go to a map to verify these things. Or the Mohawk Valley, which is the area west of Schenectady and east of Syracuse, that represents a cluster of counties. Our Mid-Hudson region is much more analogous to the Long Island region. I think we're somewhat ahead of Long Island in the aggregate. And of course, New York City, to hit these standards, is a much greater situation. In certain ways, it follows the decision we made to reopen our county golf courses. We have 6 public golf courses. We wanted to phase in the opening. We wanted to make sure we had the right protocols in place, and before we opened all of them at once. So we opened 2 in the northern part of Westchester the first weekend, Hudson Hills and Mohansick. They are in the less populated area of the county. They get less golfer volume than some of the ones down county do. Gave us a chance to make sure that they were solid and in place. The following weekend, we opened up the 2 in Yonkers at Dunwoody and at Sprain Lake. Similar situation, more busy than the 2 northern Westchester ones, but also in areas where we had a little bit more of a controlled environment and we could accomplish implementing it. The final 2 that we opened this past weekend at Saxon Woods and at Maplemore are among the busiest ones. They're the most visible ones right along the Hutchinson River Parkway, major roads in Scarsdale and White Plains. But by the time we opened them, we had already had a 2-week and a 1-week experience with the other courses. In many ways, this is analogous. You're going to open up parts of upstate first. You're going to work your way down to the suburbs around New York City, and then New York City will be the last piece of the puzzle. Now, keep in mind, it's very important to look at this holistically. I am tasked with being county executive of Westchester County. And in a narrow view, I don't necessarily care what happens in Rockland County or Ulster County or on Long Island or in the city. But that's a foolish viewpoint, because the hospital beds of Westchester County are the bulk of the beds in the region. If someone gets sick in Rockland County, there's no wall around Westchester County. We don't say you can't come to the county center hospital facility because you live in Rockland County or you live in Dutchess County. Why would I foolishly cut off a neighboring county, and that's the basis upon which somebody would be denied health service? That's absurd. So we function with neighbors within a regional context. And then we also have to remember that so many people live in Westchester County, 200,000 or so people every day would normally commute into New York City to go to work. I was one of those people for many years in my corporate life. And when you get on Metro North and you go into the city, if the city, New York City, is shut down, what good does that do me living in Westchester County? I need to know that my job is open for work again in New York City, if that's where I happen to work. So to sit in the Hudson Valley and say, hey, the Hudson Valley is open, isn't it great? It is great. But until New York City is open, we're not going to function as a full society. And I must tell you, when I listen to people and I read people that want to subdivide us, as seems to be the way to go these days. You want to subdivide people by gender. You want to subdivide them by age. You want to subdivide them by economics. You want to subdivide them by race. You want to subdivide them by religion. You want to subdivide them by geography. It's foolish. We're in this together. We are all on this planet together. This virus has gone from Brazil to Spain. It's in Russia. It's in China. It's in Seattle, Washington. It's in Nebraska. And it's here in Westchester County as well. And to fight this and to think in terms of, well, our situation is better than yours, we're not going to have a functioning economy and all the things that go with it until this virus is in remission everywhere. So we do care about what happens in Dutchess County and Rockland County, and we do care what happens in New York City if what we want is to stop the illness, stop the deaths, and also to reopen the economy. And I think, perhaps being terminally moderate in everything that I do, that this kind of moderation isn't in style these days. It's much more stylish to be much more extreme in your point of view, politically and in everything else. But that's not where the solution to this problem comes from. The solution to the problem is not, we want a virus treatment tomorrow. Well, if tomorrow the virus treatment is discovered by science, then by all means, let's spread it about. But the desire to have the treatment is so great that we start following false options, things that really aren't proper treatments, but we want them to be proper treatments. I'm a New York Knicks fan. I want the Knicks to win an NBA championship. They don't have the personnel to win the NBA championship. Not now. Hopefully they will in the future. But wanting it and having it happen are two different things. And what we do learn from when we're children to when we're adults is that you must have patience. You must have energy to persevere, whether the things are optimistic or pessimistic, but you persevere anyway. That's how we won. And when you look on American history, how did we win in World War II? How did we survive the Depression? How did the Civil War turn out? It didn't get resolved in a month or 2 months or 3 months. It took years for those things to be resolved. And we have to have the fortitude and the stamina to understand that's what it takes. So making these 7 goals, which I've tried to be more specific so you understand what's involved in them, this is what has been laid down by the governor. And it makes logical sense in the broad base. When we know we have less deaths, when we know we have less people hospitalized, when we know we have less new people coming in to be hospitalized, when we know we have proper testing, when we know we have the proper number of hospital beds available to help people and treat them, and when we know we've got an effort made to research the contagion out there, doesn't it make sense that that's the basis upon which we reopen the society? And I'm optimistic. I think we're very close to meeting these goals. I think once we meet these goals, where there's 4 phases, we'll talk about that another day. And as those phases go through, we'll see the reopening of the society. We'll see the reopening of some things right away, some things as soon as possible after that. I want to see retail open. I want to see restaurants and bars open. I want to see us have events. And if those events can't happen in June, hopefully they're going to happen in July and in August. And if they can't happen in July, then they'll happen in August and September. We'll do them as quickly as we can responsibly. And then if changes do occur, where those numbers start to go up on us again, then we'll adjust what we do. And we'll do some things and we won't do other things. That's the story of how we've treated our parks. We've allowed for some things to happen, and we've kept other things closed. And we've made those decisions rationally. Now, we may make mistakes. I know this seems like an unbelievable thing to say for an elected official, a politician, if you will. But if we're wrong in something we do, and we grasp that we're wrong, we're going to stop doing it. And we're going to reverse policies. We're not going to be so mired by ideology or partisanship that we're not going to do something differently if doing it differently means we're going to do it better. We're going to be flexible based on what's happening out there. But we're also going to be practical. A county government has certain authority. And we try to use that authority as wisely as we can. the way we handle our emergency services department, the way we handle our county police, the way we handle our Department of Health. The state is the superior authority to the county. And in these matters, the state authority matters. So we're going to work very hard, try to accomplish these goals, do them effectively. Hopefully the numbers will show the continued progress against the contagion. We'll start the process of opening up the society. It will not be overnight, but it will be progress. You'll see progress. Hopefully during the course of this month, next month, and the month after that, things will get better, and we'll start the road back. The road back is a long road, but just like the wagon trains that left the Missouri River for the West Coast, it took a long time for the wagon train to make it. But over the course of time, it succeeded, and our country grew and prospered. It didn't happen in a year. It didn't happen in 20 years, but it happened. In this case, it won't take a year, we hope, but we do believe that we're on the right path. We're on the right trail. That's the trail we're going to pursue because we think it's the right policies. So I'm going to stop the narrative, go to any questions we have. Catherine Chaffee is with us. Catherine, what questions do we have from our friends of the press?
Okay, so the first one comes from Jay Sears. He asks, any update on the progress on nursing home testing and including senior housing in this program?
Well, Westchester County has taken on that responsibility. I don't have a statistical report. I know Jay reports in the city of Rye, which is my home community, and I know that he's interested not only in results at the Osborne, which is a traditional nursing home and assisted living environment, but also in the Vienna Housing Project and Rye Manor, both of which are senior-based rent-subsidized programs. I don't know that the state doesn't regulate the senior housing in the same way that they do the nursing homes and the assisted living. So getting those statistics together can be a lot more difficult. Again, we're at the mercy of the state, which collects all of the testing data, all of the fatality data, and then we have to try to access it from the state. I don't have an updated report, Jay, and this applies to anybody in any other community. If you're reporting from the Independent down the river towns, you want to know what's happening in Irvington and Sleepy Hollow. If you're reporting from the Examiner, you want to know what's happening in Mount Kisco and in Newcastle and other communities. We continue to try to get access to the data from the state, and as soon as we have it, we'll certainly share it with you.
Okay, the next question comes from News 12. It's Nikita. She would like to know, considering how important contact tracing is for the county to reopen, would you encourage people in Westchester to apply?
We're trying to figure out, make sure we understand how the hiring process is going to work. We've been told that people can apply by reaching out to the structure that the Bloomberg entity is dealing with, and that they're going to be screening and doing training and then assigning people. We know how many we need to have, and we know that we have a certain number of people that are happening. So I think what we'll probably do is tighten up exactly what the point of action is. I believe there's a portal established for this, but let me not speak off the top of my head. We'll talk independently to our friends at News 12, Nikita. We'll have that information for you shortly. We'll do a little bit of homework. But the bottom line is that the county is not directly hiring. We're not saying, call Jim Smith within our organization or send your resume here. There is a conduit by which a person expresses their interest, and then the training that they go through, and then the assigning that goes on after that will follow. So we'll try to get some details on that, and hopefully we'll report publicly to everybody tomorrow. We'll make it a point. I'll ask Emily Lavin to help us through other resources we have here to help make sure that we get that information available, and we'll get a clear idea of what process an individual goes through if they want to be a contact tracer. There's two other positions as well that have supervisory responsibilities.
On the same topic, this question is from David at the Journal News. How critical is contact tracing to keeping the county's economy open and moving to the next phases of business?
Well, we're told, David, that it's one of the 7 pillars that we have to satisfy. And I'm sure that at some point in time, once we've operated contact tracing, that the state is going to require to see certain results. And those results are going to have to be of a certain level of intensity. It's not enough just to have the bodies in place. My understanding is that the state will determine if and when there's a reason to shut down a region that has opened. And so we're going to want to hit our mark in the number of people on board and the amount of work that they do per person. They view this as being essential in tracking the potential respreading of the contagion. And it's a very difficult task. I don't underestimate how easy it's going to be to do this, and the number of people involved is really tremendous. But as we get through all of this, we'll do our very best to report as to how we're doing. And then out of that, we'll determine if that's going to help us maintain the continual opening. The way it's been structured by the state is as we hit the threshold of these 7 categories, we open up phase 1. A certain period goes by, all the numbers look good, we open up phase 2. And our desire, obviously, is to get to phase 4, which I gather is the full opening of the society. Now, the full reopening of the society may not be on the same basis. It may be that a restaurant that had 80 seats reopens ultimately with 50 seats and reconfigured a certain way. It may be that a business that had a certain type of physical layout is going to have to adjust that physical layout to limit the number of people that can come in at any one point in time and socially space them. But the reopening of the society means that these businesses will be allowed to function again. And that's essential for us on every level. It's essential for us to get as much sales tax revenue as we can to shorten the impact of what we face economically.
Okay, next question, also from David. What can be done if an infected person does not want to divulge information? How much of a concern will that be?
Well, it's a concern. We haven't reached the point of a person who stonewalls voluntary information. I don't know legally what our authority would be to go beyond that to gather information. Obviously, we've tried to enforce these rules, appealing to people's common sense and appealing to people's understanding that this is a crisis for which there are fatalities. There's over 1,200 people that have died, and that's why we're doing these things. We're not doing them because we want to be intrusive in people's lives. How easily a person will be able to identify those they've had close contact with is also questionable. And, I'll just personalize it. If I stop at a luncheonette in the morning, get a cup of coffee, I might know one of the 3 people that I interacted with, had a mask on, I was at 6 feet. But if the contact tracer wants to know the names of those 3 people, I can give you one of the names, and I'd have to find out the other 2 names. And that's going to be difficult to do if you multiply me as one person by all the people out there that in theory test positive. So it's going to be a challenge. It's not going to be easy. And the original question is, what do you do with the person that's recalcitrant? And, I'm not sure exactly what we will do. We're not going to look to arrest them and enforce the law with such severity. But at some point in time, to do the job that the state requires us to do, we will have to be persistent and, ask for information that, many people might find intrusive. But the mission here is public health. It's not to know for the sake of knowing.
And the last question from David is, will people that came in contact with the infected person be told to self-quarantine?
Well, that's in essence what we were told right at the very beginning of this, that there was a preventive quarantine if you thought you had contact with someone who was COVID positive. And many of us, I went through it on 3 separate occasions where we were waiting to get the test result of somebody who was being tested for COVID. And we were prepared to quarantine because we thought they might test positive. All 3 cases turned out to be negative. But in that period of time between taking the test and knowing whether they're positive or negative, myself and a number of us here, were on tenterhooks about how we would not interact with people during that period of time. So I assume that protocol still applies. What we're hoping now is that the level of contagion is dropping, and that is going to make it easier for us to do it. At the peak of this, when we had, 20 some odd thousand active cases, 12,000 active cases, that becomes an almost inconceivable task. Now that we're down to 3,300 active cases, maybe less than that today with the tracker, it's a more manageable process, but I don't underestimate how hard it's going to be. And I don't think it's going to be something we snap our fingers and everybody will comply. But it's essential in theory if we're supposed to try to reduce the spread of the disease.
That was the last question.
Okay, with that, we thank you very much for paying attention. If you have any other questions, by all means, reach out to Catherine Chaffee. We'll try to be available to our friends in the press to answer some detailed questions. Obviously, I indicated there are certain questions here that I could not answer. We'll try very hard to get the answers where they are gettable. Sometimes when it comes down to assessing state policy, it's not merely ask a question, get an answer. They're debating about what to do, and they haven't established what that policy would be. But we will do our best to try to do that. We will be reporting again in this format tomorrow at 2 o'clock. We will be in the city of Mount Vernon. Earlier in the day, we will be delivering masks for distribution to those in Mount Vernon that need to have the facial covering and for everyday realities. And then the update will be in Mount Vernon City Hall to give that update. We'll be on as well with State Senator Andre Stewart-Cousins at 11 o'clock for a Facebook Live update. Senator Cousins and I have been colleagues for a long time, both in the county legislature and the state legislature. She is now, by every poll, the most important elected official in Westchester County. I defer to her abilities as a state leader, and we'll be talking a little bit about this state role that's so important in fighting this disease. In the meantime, please stay safe. This is George Latimer, County Executive. We look forward to seeing you tomorrow. Hopefully all of us in good health.